Hi guys, I'm Alyssa. So today we're going to be talking about breast care and vulvar self-examination. So with breast care, there's actually three different ways of detecting breast cancer early. So the first one would be self-examination. And with self-examination, this is typically going to start when a woman turns 20 years old. It should be done once monthly, and it should be around the same time each month. So a good time would be 1 week after the start of your menstrual cycle, and this is because your breasts are less tender at that time. So what we want a woman to get out of this is that we want her to know what her breast feels like, what's okay to be there, what's not okay to be there, what's usually there, what's not there. We want her to know what they look like, what they feel like. We want her to know everything about them. So there's actually three different ways that you could inspect your breasts. So the first way would be to look into a mirror, and this could be done in four different ways. You can raise your arm, you could have your arms against your side, you could have your arms on your hips, you could even bend forward. Typically it's best to do it all four ways so that you can feel and see everything. So you're going to inspect from the outside in. You're going to feel with your fingers, basically feel if there's any nodules, anything firm, anything out of the ordinary. Look for dimpling on your breast, discoloration, maybe red blotches that shouldn't be there. You're going to check your nipple, see if it's inverted, see if the color is wrong. You're going to go ahead and squeeze your nipple, see if there's any kind of discharge there. So the next way would be lying down. You're going to raise your arm above your head, and again, you're going to do the same thing from the outside in. Check for any discoloration, any nodules, anything hard, any dimpling. Check to see if your one breast is bigger than the other, if you feel any lumps, anything out of the ordinary. The next way would be in the shower. You're going to raise your arm with wet soapy fingers. You're going to go from the outside in. You're going to check your nipple, look for any discoloration, see if one breast is larger than the other, see what's normal, what is not. This is key in helping to detect breast cancer early. So the next way to help detect breast cancer early would be professional breast examinations. So this is done by your doctor. It's usually done annually at your annual gynecological exam. It's basically the same thing as a self-examination, except that a doctor is doing it. They are specifically trained to feel for different masses or anything unusual on the breast, and they are likely to determine something that maybe you missed or maybe you didn't know was abnormal. So this is something that is done annually. Again, recommended for women over the age of 20. So then the last and final way to detect breast cancer early is mammograms. So mammograms are typically done for women over the age of 40, and this is done annually. It could also be done earlier for women that are at a greater risk for breast cancer. For example, if it is perhaps hereditary, you start it earlier. So the way this is done, your breast is squeezed between two plates, and it basically is an x-ray of your breast. It is able to detect nodules extremely early. It is able to detect them before your provider or the woman themselves can feel it during a self-examination. This is something that they can see before they can feel it. So that's always a good thing. It is extremely important for this to be done after the age of 40 years old. It could be life-saving. So the best time to actually feel, or I'm not feel, but the best time to actually schedule a mammogram would be after your menstrual cycle, because your breasts are less tender at this time. So now moving on to vulvar self-exam. So this should typically be done with women 18 years and older, or sooner if you are already sexually active. So a good place to start is to get a mirror and to go into a room that has plenty of lighting so that you'll be able to see. So you're going to basically check yourself, see if you see anything abnormal, any lumps, bumps, anything that just shouldn't be there. You're going to then palpate your mons pubis. You will also palpate your vulva to see if there is any bumps or any malignancies, anything that hurts, anything that should not be there. You're going to check for infection. You're going to check for everything. This should also be done once monthly. If anything abnormal is found, it is important that the women report this to their provider. That's all for today, guys. Thank you.